Hello, everyone. This is Rohit from SabaiHealth. Um, I'm delighted to have Dr. Rosvinder. Dr. Rosvinder is a friend, and he's been a great advisor for me and the family on everything health, mental and physical. And I think, Doc, thanks for taking the time to come and answer some queries.
Hi, good evening, Rohit. Thanks for having me on.
So, Doc, do you want to do a quick introduction of yourself, and then we can go straight into the questions?
Sure, certainly. Rohit, I would like to start by thanking Sabai Health and thanking your good self, for starting on this very generous and fabulous journey of bringing health uh, healthcare awareness to people. And I think you're doing a great job, right? And also congratulations on the launch of your first book, The Simplicity Trap.
Thank
I've
you.
gone through and I'm at chapter 1, and I'm excited to finish that book. So my name is Dr. Rosvin, and I'm a public health medicine physician, and I'm also an epidemiologist. So my base medical degree was from the Ukraine, and subsequently I have a master's in public health and also a PhD in public health. And over the years, I've worked with vast amount of population. My special interest still lies among the marginalized population. However, over the years, I've worked a lot on health promotion and also working in the field of women's health, as well as NCDs. And currently, my portfolio mainly looks at the communicable disease component of things. Nevertheless, I'm very excited and happy to be here on Sabai Health's session 2 for us today to talk about a very, very important topic that that you have brought up today, Robert.
Thank you, Doc. I'm excited as well. So, actually, we've noticed among the queries that we are very clear. We're a care companion. We are not a doctor. We never give any advice. We only help people get better by working with them. So we remember them, and when they need to go and meet a doctor or a healthcare professional. Now, we typically notice there are a few queries which are the most asked to us. Initially, it was always nutrition and food being the number one query, followed by chronic care, followed by medical diagnostics, people sending a bunch of reports and saying, what does it mean, right? Now we are starting to see chronic care go up every week, so much so that it's more than a third of all queries that we have. Now, every country seems to have a nuance. So Thailand, we seem to have a lot more kidney-related queries. Malaysia seems to be more heart-related queries. India seems to be more diabetes and a few other queries, sexual health, etc. Across the board, we are seeing mental health and women's hormonal health as topics of specific interest as well, and skin health. So our first session was actually mental health last week with a psychologist. And it was about how far should you go with your mental health on AI? Because we don't want people to think everything can be done through AI either. So, and that was the topic. So today, we would like to go a little deeper into diabetes management, because obviously we are seeing quite a bit of interest. And what we want to do is not get too technical. Maybe we can start with, from your perspective, can you tell people what is diabetes, and also a little bit about what are the different types and how does it develop? Because I think that's quite important, because our age segment is 57% of our users are female, and a significant part, more than 60+% of our users are typically within the 32 to 45, 46 years age.
Okay. All right, Rohit. So, to answer your question, I think you have framed it quite well. The topics that you have listed just now, these are very important topics that are currently the burden around the world, right? So it's it's also good to know that people are, looking out and trying to seek information about these different types of non-communicable diseases that we call, because that seems to be the new or the existing um, burden, and which has just sort of doubled or tripled over the years. So if we want to specifically talk about diabetes, right? So I like to give a little bit of historical context to things
Mm,
usually, to try to let people understand where did this word come from, why is it called diabetes, and so on, right? It is uh, so diabetes basically, in Greek it means to siphon, or passing through. And in those days, diabetes was very much closely related to urinating excessively, right? So that's how the word diabetes came about.
mm,
And later on, they added the entire sort of disease of diabetes was called diabetes mellitus. And the word mellitus means honey sweet, right? So just from the origin of the words itself, we can see that, it just literally means that, you're passing urine which is sweet. Now, how to understand this? Basically, diabetes is a long-term condition, right? Where the sugar levels in the body, it becomes to higher levels. That's the basic understanding, right? A raised sugar level in the blood. And this happens mainly because of one reason is in your body there's this hormone called insulin, right? And this insulin hormone, its function is it helps the sugar it binds with the sugar to help it go into the tissues, right? So when our body needs the glucose because it needs to metabolize, it needs to, the cells need to live, the brain needs to work, and all these needs some level of sugar inside the body. So insulin is the key, right? That binds with this sugar that comes from external sources and goes into the tissues, right? So when the insulin binds with the sugar and goes into the tissues, that's when the body turns these food or the glucose that we are taking in into energy, right? So what happens in diabetes is either number one, your body is not making enough insulin. That means there is low level of insulin in your body to bind and to do what it's supposed to do. That causes your sugar levels to be elevated. And the second thing is you have enough insulin, but your body is not able to use this insulin properly, right? Now, if you look into the world today, right, Rohit, it is about at least the WHO says about almost 600 million, right? To be exact, 589 million people, especially adults, anyone from the age of 20 and above, youth and the elderly, are actually living in diabetes. That's actually 1 in 9 adults around the world. And the WHO also believes that there are at least about 300 million people who live with diabetes, but they don't know they have it. Or, about
mm,
43% of the people are actually undiagnosed. And the pressure is because 81% of these people who are living with diabetes are actually in either middle or low income countries, right? And it is causing a lot of death, and it's estimated to have one death, diabetic related death, every 9 seconds in the world. Right now, there are various types of diabetes, right? Like your question just now. So there is type one. Type one diabetes is what we call the diabetes when your body is producing very little or no insulin, right? So insulin is a hormone that's produced at the pancreas, an organ in our abdomen, and because of the low level of insulin or no non-production of insulin, it causes diabetes type 1. And then there's a diabetes type 2, which is the most common, and that's the one that is affecting millions of adults worldwide. And this is
mm,
linked to when the insulin that you have in your body is enough, but due to the insulin resistance, it is not doing the function that it's supposed to do, right? And then this has many reasons to it, which I think we might be exploring further later in details. But
mm,
um, The third type of diabetes is what happens among pregnant women. That's what we call gestational diabetes. So this happens, and this only occurs during pregnancy. Sometimes it sticks after pregnancy, but most of it resolves once the pregnancy is, um, once the pregnancy is done with. So, but yeah, in short, this would be a little bit of the history of the word diabetes itself, and what are the different types of diabetes, and the simple understanding of why it happens.
Thanks, Doc. That's really useful. I'm going to give you a few statements, and then obviously I think you'll understand where I'm going with the next question. Some of the common queries we get is, I'm urinating often. Do I have
Mm-hmm.
diabetes?
Mm-hmm.
I'm thirsty. Do I have diabetes? I'm hungry. Do I have diabetes? I have low sex drive. So do I have diabetes?
Mm-hmm.
Um, we get all kinds of queries, right? And it goes back to the same question on, what are those early signs or common signs that people, if there is anything there around, people can figure out that they may be heading on that path? And how can people get tested for diabetes? Is it as simple as just buying a strip at home, or is there more to it? Because one of the things Sabai wants to achieve is we want people to do medical checkups more regularly.
Mm-hmm.
And in fact, we do encourage our users from time to time to say, when was the last time you did your medical checkup? So, yeah, that's really the question.
Okay, thanks for that question, Rohit. So yeah, I would agree with the triggers that Sabai Health is providing your users with, because I think it's important for people to get tested, along with identifying or recognizing what are the common symptoms that could be there. So I would want to say, Rohit, that moving forward from this point, I would talk mostly about type 2 diabetes, right? Because that's the most common type of diabetes that is affecting majority of people around the world. So we will stick around most of our questions around the type. I mean, the answers will be more towards type 2
Okay.
diabetes. So in type 2 diabetes, the one that is affecting most adults, right? So the common signs, the frequent urination is one of the most common signs, right? A lot of people complain of they think that they are drinking a lot of water, but they are not, right? But they are just frequently, going to the loo, they're urinating more frequently, and then this causes them to be also feeling a little bit thirsty, right? And in medical terms, we call that polyuria and polydipsia, where people are, there's increased level of thirst in people, and a lot of people also feels hunger pangs. They get hungry quite fast. Most of the people have these, um, I would say, initial symptoms when they are talking about type 2 diabetes. Then there is also some symptoms that that I can say that happens more chronically when someone is living with diabetes, but they don't know about that. Most of them will do explain some level of weight loss, right? There is a pattern of weight loss, where their weight is they're losing weight on their limbs and things like that, and they are feeling tired all the time, And then if it is chronic enough, sometimes people will start to have slow healing wounds, right? When they have an
Mm.
injury, these wounds might heal slower than usual. And sometimes some people, we do get people who present to the clinic with recurrent infections, like a very huge boil behind their back, and this keeps
Mm.
coming back again and again. And then when we do recommend them to do a diabetes test, then we realize that it is type 2 diabetes, and that's what's causing the recurrent infections, in people. And basically, I would say these are majority of the patients, adults who have type 2 diabetes would have these type of symptoms. Some do come with also some level of blurred vision, but I would say that is more, when someone has been keeping these symptoms for quite a long period of time before they
Mm.
develop some level of impairment in their vision. To answer the second part of your question, how can one get tested to see if they are living with diabetes or not. So there are many types of tests that we can do when we want to check ourselves for diabetes, right? So the the first and the most, I would say, important, or the most prescribed test to people is usually the fasting blood glucose test, right? And that is one of the main tests that we always advise our patients to do. Of course, there's another type of test that's called the random blood sugar test. And these random blood sugar tests is something that most people do even at home, where they just prick their finger, they use like a finger prick test, and test the capillary blood just to look at the sugar levels. And this is what we call a random blood glucose test. And then there's one more test that is quite um, prescribed widely. This is called the HbA1c. Right. A lot of people always ask this question, like, why is something so
Yes.
special about this test, and why are doctors always including it
Mm,
in our blood test? So, in simple terms, right, what does HbA1c means? It reflects the sugar control that a person might have over the period of 2 to 3 months, right? The past 2 to 3 months, how has the level of sugar been in your body? Now, you might ask, like, how does the test know that this is reflecting three
mm,
months, right?
mm, mm.
Now, this test actually measures how much of the glucose is attached to your red blood cells hemoglobin, right? So the hemoglobin that is inside the red blood cell, right? It tests how much sugar percentage is attached to these hemoglobin in your blood, right? Why 3 months? Because a red blood cell in our body lives about 100 to 120 days. That's approximately 3 months. So that is why
Okay.
when we do a HbA1c test, it tells us
Okay.
exactly how much of the percentage of these,
Oh, that's very
concentration
useful.
is in your blood, and that's why we would always say that it is um, it is for us, it gives a better picture about how well has the control been in someone's body. Of course, there are a lot of there are a lot of contraindications also when we come to talk about HbA1c test. But we don't want to go around in that area. Of course, when you visit your doctor, they will go through your history, they will go through your underlying medical conditions and so on, and then they will advise what is the best test for you. But HbA1c is the most common, widely prescribed test that most people would benefit from. And most of the time, testing blood sugar with all those tests that I've mentioned, it's pretty easy. It's just a blood sample that is taken, depending on the type of test. And most of the times, we advise our patient to fast. But for the HbA1c test, you actually don't need to fast. You don't need to fast for that test. So yeah, this is a little bit about testing
Actually,
and also yeah.
Doc, you kind of literally stole my next question, and that's great. HbA1c is a common question we get as well,
Yeah,
right? Common
yeah,
questions like, my HbA1c is 5.1, my HbA1c is 5.7,
correct.
6.1. Am I diabetic? You know,
Hmm.
and
Hmm.
I was reading some study before this meeting actually, which said that again, it's Google, so let's take it with a pinch of salt. Um, that 70% of HbA1c people who are above 5.8 end up becoming diabetic.
Hmm. Hmm.
Um,
Hmm.
so again, how can one read into this? And if our group of users, which are 30 to 45, there are people who are in that space of being 5.1, 5.5, 5.7,
Yeah,
5.86,
yeah.
6.2, what advice would you give for them?
Okay, so yeah, HbA1c, there is a range for HbA1c, of course. Anything below
Okay.
5.7, we take it as it's still within the normal
Okay.
range. And when it's
Okay.
5.7 above to about, some literature would say 6.2, some literature would say 6.4. But we know when someone is in that range is where we need to start to look after ourselves better, because we are already considered to be in the pre-diabetic range. right?
Mm.
And anybody who is 6.5 and above is considered to be within the diabetic range, right? And
Okay.
most of the time, that the latest targets, when we are monitoring, or people who are living with diabetes, when we are monitoring their control, we would want to keep the HbA1c between below 7% most of the time, right? That's why we want to make sure that the control is within 7% and below. Now, how can we take care of ourselves? So there are two prongs to this question. One is when we are at the pre-diabetic range, right? I would say when we are at the pre-diabetic range, there are certain things that we need to do to change our lifestyle, definitely, right? First, we need to look at um, the foundation of general metabolic disease management, right? It is, the pillars are eating healthy, right? We talk about balanced diet. We talk about food that has high fiber, protein, but with fewer refined carbs. The keyword is fewer, not to say zero carbs, right? We still need carbohydrates to let our body function, but we need to make sure that we choose, the better types of carbs that we are taking with our meals. But then why I said better types is because it depends on individual to individual. You'll be surprised when you hear people saying that, if I eat a dosa, I would not have my sugar levels are okay. But when I eat food B, my sugar level starts to go beyond control. It's different from different people to different. So this is something that we need to look at. The idea is basically usually to reduce refined carbs, and we cannot move away from regular exercises, right? Weight control is one of the pillars, because when we talk about I remember I said just now, your body has insulin, but it is not utilizing it well because of insulin resistance. Majority of the insulin resistance is because of obesity, right? It is when someone has excessive, especially when they have excessive abdominal, or what we call the visceral fat, right? And that is, it leads to something that is called insulin resistance. And that is why obesity can be one of the major factors of developing diabetes type 2.
Okay, so
And
Doc, we have
yeah,
some questions as well.
sure.
So here's a question from Raj. Again, where it's too specific, feel free to tell them if something is too specific. To say, what does someone like me do who has HbA1c stuck for 8 to 9% for years? Even when I'm taking medication, following a diet, what should my next step be in such a situation? Does it mean I should change medication, increase the dosage, or something else? Or does it mean I should change my doctor?
So, okay, now, uh, you know, uh, when something like this stuck happens, right? We look at it as something what we call a clinical sort of what's the word, like it probably inertia or something like that.
Mm,
Where
mm,
um, medications definitely needs to be adjusted. That is point one. Sometimes, okay, so this is of course not a live consultation session, but
yeah.
sometimes optimization of certain type of medication. So each drug that we prescribe to our patient, we always start
Mm,
with the minimum requirement that is there, and then we step up. It's called optimization
mm,
of the drugs. So if the drugs have been optimized, number one. Number two, sometimes it needs to move beyond from oral uh, hypoglycemic agents to insulin, right? That would be the next part of thing. And of course, if you tell from what I hear, he's been consistent. If he's been consistent with his medication, that is something that we want to strike out from our list of when we want to monitor our patients that have reached. And you know um, it could also be uh, uh, to me, in this kind of situation, I would say, you don't need to change your doctor yet. You need to uh, question the optimization of your medications, right? Has
mm,
your doctor optimized your medications well, right? And maybe the testing needs to be done more, I would say, you need to do the 2 hours postprandial, 2 hours postprandial test as well, where after each meal you are doing your self checks to see what are the types of food that you have. So we call it like a diabetic diary, right? You have your meals written down, and after each meal, 2 hours post each meal, you are also doing a sugar test yourself at home,
Mm.
just to see in a week when what type of food that in your daily intake is actually causing these to rise. And definitely you can, your doctor can recommend a dietitian for you as well, and you'll be able to get um, extra assistance from the dietitian to relook. And sometimes they do help you to calculate your macros and micros to ensure that your goals of refined carbs and all are reaching. Yeah, so that I would probably
Thank you.
summarize that answer that way for now.
Very nice. Thank you. I
Yeah.
think the second question is from Rajini. Some people are prescribed 2 or 3 medications, including metformin. How can a patient understand these medications better? And what are the potential interactions or side effects that I should be aware of?
Okay.
Again, I'm
So
I've
yeah.
not read the whole question. I've made a summary of Rajni's question.
Okay.
Yeah.
I think Rajni's question is mainly regarding the types of medications. Yes, you're right. Sometimes your doctors might prescribe you more than one type of medications. It all depends on what we are trying to help the body do, right?
Mm,
I've not mentioned about the other type of tests that we do when we are suspecting, insulin deficiency. There are many types of tests that are there available for someone to properly look into the diabetic problem. Definitely, I would advise that you can get a deeper understanding or a view from endocrinologist, right, who deals with the insulin hormone itself, for you to understand what are the different types of tests that you might need to go through. Now, generally about medications, all right, most of the common medications, like you mentioned just now, it is metformin, right? And metformin will improve the insulin's sensitivity, right? And it also reduces the liver to produce more glucose, right? So that is the function that metformin has, right? And there is another group of drugs as well. These are the sulfonylureas, and these drugs actually help where, when the pancreas is releasing, it will help the pancreas to release more insulin so that the sugar levels can be brought down in the body. And there are many other types of tests that are available, depending also on the patient's underlying medical problems. There are some drugs that we cannot give if you have uh, underlying baseline kidney function that is a little impaired, or if you have underlying kidney issues or things like that. Then there are some medications that we cannot prescribe to you, and sometimes to have optimal control we would need to combine more than one type of medication for a patient. So yeah, in short, that's my answer when we're talking about medications. Most of the time, the side effects. I think the second part of Rajni's question was on side effects. Whenever you're started on any anti-hypoglycemic agents, the tablet, the oral form especially, periodically there are certain body functions that are how to say these certain body functions that are periodically checked, right? They look at the
mm,
kidney functions, they look at the liver functions, they look at how your body is responding to these medications overall. And most of the time, monitoring of the kidney function and liver function is something that is done because sometimes there could be some side effects that are there on the kidneys or the liver when it comes to chronic
mm.
medications. However, these side effects are usually very, how to say, rare. They do not happen to every patient that is taking these medications, but it is required for the doctor to periodically check your blood. It's most of the time 6 monthly. Sometimes in some patients it's 3 monthly. They do these tests to monitor your body functions.
Okay.
Yeah,
Thanks, Doc. So what I'm going to do is I'm going to come back to some of my questions, and then there's one more question to hand. I'll come back to that, but let me come back to my
sure.
questions as well. And I know this is a topic very close to you, knowing you. What about the mental and emotional side of things when you have diabetes? There's still a taboo with diabetes. There's still a, a, a tag with diabetes. I have diabetes. And of course, then you see legends like Wasim Akram, the probably one of the topmost cricket players. You
Mhm.
see Alexander Zverev playing a 4 hour, 5 hour brutal tennis match. During the match, taking an insulin shot, and living their life.
Wow.
But at the same time, there are a lot of people talking about, oh, I have diabetes. My life is, basically in trouble, something like that. So how do you handle the emotional and psychological aspects when you first come to know that you may be diabetic, or or you're just going through that journey?
Yeah, I totally agree with you, Rohit. I think any person given any chronic diagnosis from the doctor uh, is going to have some level of mental and emotional struggles. We are not denying this. This happens to every other person that's been diagnosed. And because diabetes, in the ADA says that it's actually not only a physical condition, it is also emotionally, it's an emotional struggle as well. Because a lot of patients do have what we call the diabetic distress. This happens when the person is newly diagnosed, handed the diagnosis of, here you are now, with diabetes. People might feel very overwhelmed. They feel a little
Mm,
trapped. They feel like,
mm,
what have they done to themselves, right? And
mm,
uh, so we must go back and remember that diabetes has a lot of factors. There are a lot of factors of when someone can develop diabetes, and one of the factors is also genetic, right? I like to tell my patients that when we are born, our body is like a switchboard. Our DNA is like a switchboard. All the switches are turned off throughout our journey, our life. Sometimes there are some we say modifiable risk factors. This could be the habit of eating, the way we the sedentary lifestyle, our mental stress and things like that. And all these can have an impact on how different chronic diseases can be developed, because we also have the DNA in our body that we carry from our ancestors. So this is something that we must remember. Sometimes it's there, but throughout our life, the lifestyles, actions that we have, this can trigger these activation. And another thing that a lot of patients who have diabetes have, Rohit, I think from the questions that we got just now, it's the diabetes burnout, right? It's this burnout where we know, like they know what they are
mm.
doing. They
Interesting.
know that they have to take the medications. They know what to do, right? And then they just feel like I just can't do this anymore. Like, and that's when they start to question whether is my doctor doing the right thing? I'm reading this, and there's so much happening around. And we live in this information era where there's too much information, right? And with the existence of AI, where we do a lot of cognitive offloading, we offload
Mm,
our the capacity to the AI to do, you know, all this is causing a lot of people to get too much information from too many sources, and that sort of causes people to have a lot of burnout as well. And a lot of my clients as well, when we newly diagnose them with diabetes, even high cholesterol for that matter, they do, in the initial days, they do develop a lot of guilt and shame, right? Now,
mm,
this, what I want to highlight here is I am certain a lot of our listeners, those who are diabetic, might be feeling this throughout their journey, right? Throughout their life, because it's something that is chronic and you have to deal with this. It is, you must remember something, it can be a vicious cycle, all right? And your poor glucose control is going to give you the tiredness, the fatigue, sometimes the brain fog and so on. Makes you have less energy, and then you do less self-care, and this is going to worsen your blood glucose control, right? And that's just going to add to the cycle. You're going to become more depressed. You're going to become more guilt. There's going to be, your sugar controls are going to be even worse, right? Now, what really would help you, right, is you need to separate that one thing you have is blood sugar levels that you need to monitor, and then it's self-worth. So your self-worth should not be defined by the numbers that you're looking at the machine or the numbers that your doctor is telling you, right? So these are two things that we need to separate. When we separate them, we see that our self-worth, we are, like you said, you're still the person who is playing sports. You're still the person, you're still the person who is working. You're still the person who's, bringing in food for your family on the table and so on. And this levels of sugar is just one part of your life that you can control, and you are controlling it. You're doing all that you can by taking the medications and so on. What it does in return, it will separate these two areas, and the chances of you developing some level of diabetes burnout, I think, would definitely be reduced, right? So I these are probably some tips that I can give off my head at this point of time, Rohit.
Thank you, Doc. So I'll probably have three more questions because I'm conscious of time. We have a cutoff
Sure.
at 9:45 for live. So there's a very interesting question. I was smiling, but I understand her pain. Shamala says, "My mother, my aunt, my granny, everybody has diabetes. I am 34. Am I heading there?"
Okay. Now, so like I said just now, you could be having this, the DNA, the genes or something, because there is a family history. There are multiple people, all right. Especially if you say your aunt, your mother, and so on. These are like a first degree relatives, right? And it, of course, studies say that if your first degree relatives have diabetes, it increases your risk, right? Sometimes almost twice as much as other people, right? Now, whether you are already on the pathway, this you have the answer to this to yourself. Now, how do you ask, right? You need to look at how is your weight doing at this point of time? How is your, food doing at this time? Are you living a sedentary lifestyle? Do you smoke? And, are you overweight? Are you obese? Right? And have you done a test for yourself? Yes, you said you're 34, but people at 34 should already start doing some level of screening, at least a yearly baseline screening for themselves, just to know where they are at this point of time. So you need to ask yourself these questions, and if you have ticked the boxes, everything is a no, right? Then there is something for you to do, which is to maintain what you're doing at this point of time, right? But if you have more yeses to those questions that I've asked you just now, then definitely you're on the path, right? But remember, this is a path that if you have started on and you are not quite at the destination yet, you can reverse this. And you can reverse this by looking at the different lifestyle modifiable changes that you can do to your lifestyle. And this will then help you to bring down the risks that you already have. Because, like I mentioned just now, you already have this in your first degree relative. It does increases your risk. But whether are you going to get it or not, this is something that we don't have exact answers to, unless you are venturing on a journey of doing a DNA analysis test that would be able to point out whether do you have these genes or not exactly. So yeah, of course there are ways for us to solidify our assumptions, but I would say at this point of time, you do this checklist that I told you just now. Look at your weight, look at your lifestyle, look at your different factors, whether are you having those things on a daily basis. Then something that you can reverse, and get yourself to do a baseline test just for you to do.
So, Doc, last two questions from us. First one is because obviously it's Sabai, so we have to ask you a AI and technology question. And I think you kind of did mention briefly about DNA just now. So, how do you think AI and digital health tools could be used by people, and where do you see, change coming in that space?
Okay, so I would say AI is something that is it's already here. We cannot live without it at this point of time. And definitely, overall, AI is changing not only the diabetes landscape; it is changing the entire health landscape, right? And Sabai is also one of the example where something that we did not imagine 20 years ago, or where people were googling this. Now this is available in a different platform, right? Um, and I would say that AI is changing the diabetes. It is giving chances for smarter glucose predictions, right?
Mm.
And it is like um, it can work as to help you with the insulin dose support, and sometimes it can also help to do some level of risk prediction in your in your life, like for Shamala's question just now, using the different risk predictions to see, this is my weight, blah blah blah, so and so, how what is my risk prediction for that, and also some level of risk prediction that we can do for complications of diabetes as well, based on the medications that they are taking and the blood results when they are going for their follow-ups and so on, right? And it is helping now, especially with managing the complications of diabetes, right? Um, we see a lot of personalized exercise, fitness, AI tools that are there, where um, we can use it as a benefit on how these AI tools can personalize our fitness journey when we are diagnosed with diabetes, or help us to do some level of lifestyle changes, especially when it comes to weight management and so on. Under the um, when we do, like I said, one of the blurred vision symptoms just now is basically when the retinal issues comes in when dealing with diabetes. There can be some level of digitized AI retinal screening that can be done, where it screens for your retina and then gives you very accurate diagnosis. Some uh, glucose monitoring tests that we see these days, that are continuously monitoring the sugar, and they are connected, where people can see their patterns, in their phones, where this is reflected on a daily basis, and then these continuous glucose monitors actually help. Like, just now I mentioned to one of our viewers who asked a question, the 2 hour postprandial test. If there is a continuous monitoring that is latched to your body, it will tell you exactly how much is your level 1 hour, 2 hours after rice, after different types of meals and so on. And not only that, AI has taken teleconsultation to a different level, where people and sitting anywhere can get access to the best endocrinologists around the world to discuss about their problems and their complications and so on. So I would say, these tools are there to support, of course, but they should not be used to replace what we call a doctor-patient relationship, or clinical care, because that human to human aspect is still very
Agree.
important for for us to have that interaction, and for the patients to also feel safe and also emotionally connected to their doctors or their healers that we say.
We are a big believer in that. We every time remind users that Sabai is a care companion. It is not a doctor.
Yeah.
Even the work we do with chronic kidney care in Thailand, which we're particularly proud of, we work with a clinic, is basically not to give medication, but to ensure they take their medication. So, what we do is when the person walks out of the clinic, our job is to remind them, did you take your medication? And if you have a
Yeah.
side effect, ask us. And if the side effect is complicated, then we will escalate to the nurses and the doctors, because nurses and doctors don't have time to check on a patient, and the patient doesn't can't get access. So where what we play a
Mm.
role is, oh, you're feeling nauseous, oh, that's normal. Or you're feeling headache, oh, as per the this particular thing, it's normal. But if it continues in this way, it increases, then you meet a doctor. And we have a
Yeah.
human in the loop, so we escalate. So the idea here for us when we did the chronic kidney project in Thailand with the clinics was, we never gave any advice. Our role
Yeah.
was to ensure people who know they have an issue and don't know what to do about it, or people who know they have an issue and don't care, can we remind them to take medicines? Can we tell them, hey, it's okay if your headaches the first day or you feel nauseous with this medicine? That's what the doctor says is normal. So
Yeah.
that's how we work. So I will I love this question as well. There are a lot of interesting questions. I literally think that can be a closing question for today.
Yeah.
So the question from Kim is, what advice do you give to a 27-year-old who's worried about diabetes in the future when I'm 40? I guess, as you said, you don't need to be 40. You could have diabetes even at 34. You just mentioned that. So,
Yeah.
anyway, he says, I am assuming it's a he. Apologies if it's a she. I can't see your profile. So, Kim says, what advice do you have for a 27-year-old thinking about what can happen to them at 40 from a diabetes management perspective? And how could I prevent it? Because I want to enjoy my sweets. I think that's a great question.
Yeah. We all want to enjoy our sweets. Yeah. Okay. So the first thing is first, breathe, live in today. All right. Um, let's worry about 40 when we reach 40. And for all we know, by the time you from 27 become 40, the world is evolving so fast when it comes to different type of disease management and so on. So we might be dealing with a totally different era at that point of time. But nevertheless, assuming that when you're 40, diabetes is still very much around, is still very much the largest burden of non-communicable disease in the world, right? And I would say the single most important thing that you can do from now at 27, because I'm 41 now, I would advise you that if I was 27 and I knew what I should, what am I going to face when I'm in 40 right now, I would have done, I would have stick to, regular exercise being something very consistent. I would not have let that to be something cyclical, right? Not getting active for a year or two, having good, a very nice looking physique, and then you know clashing down, letting life and letting stress and all overtake me, overeating and things like that, because the maintenance of your muscle, right? The muscle, the mass in your muscles and all is something that is very, very important, because that will be the highest area where glucose gets utilized. So that is one thing that I want to tell you. Keep on working on that. Doing regular exercises. Make sure that you're doing some level of lifting, and because over the years, you're going to lose your muscle mass. So as you start losing your muscle mass, and you let the fats take over it, that's something that we all do. And what I can advise you today, if you're 27 now, that is one thing that you can do. Second thing is also you need to look at your lifestyle, just as how I answered Shamla just now, right? Look at yourself now. If you're someone who is smoking, if you're someone who is overweight, if your waist circumference is above what it should be at your age, if your BMI is above what it should be, then you already have your answers. These are things that you need to work on from now, right? Likelihood of you developing diabetes now is probably lesser than when you become 40. And as when you become 40 and you have lost the level of muscle mass in your body, it's going to be even more difficult for you to regain the traction of getting physical exercise, working out and things like that. Trust me, after your 40th birthday, you'll wake up next day with pains all over your body, right? Happened to me. So you need to look at those modifiable risk factors that are there. They are called modifiable for a reason, because you can work on them, right? So these intake of sugary drinks and so on, processed food. Yeah, if this is something that you really like, then there is something that you need to work on, right? Now, is that food entirely bad? No, of course not, right? Yeah, you allow yourself to have sugar, sweet stuff once a while, but if you're something that you need like a half bar of chocolate and ice cream every day, then you know that then that's something that you are probably not doing justice to your body at this point of time. But otherwise, healthy diet, maintaining a good level of workout, at least 30 minutes, 5 times a day. That is the minimum that someone can do. That would be great. And knowing the family history is very important, right? Go through your family history. If you have parents who probably are now in their 50s or 60s, and aunts, uncles, grandparents who do have diabetes, these are the first degree relatives that have diabetes, then there's something that you need to add on to your list, that you already have one risk factor, which is the family history, right? Then what you can do is you can always do a baseline blood test. You can always do a baseline blood test, and this does not have to be only for diabetes. You can do a test overall, just looking at your kidney, liver functions, and your blood types and things like that. And that is something that you can do. And at 40, what would be successful for a successful 40-year-old be, right? Um, if you have more muscle, less fat at 40, then I would say you have done what you're supposed to do, right? And this has to definitely start now. If you want to start that at 40, that's something that is definitely going to be um, challenging. I'm not saying it's impossible, that's going to be something challenging. So these are probably some baseline advice that I can give at this point of time for you. Can
Thanks, Doc. I think it's been a great conversation. If I were to summarize, I would say that three things that I learned today, and I think you highlighted a lot: the importance of fitness, the importance of regular workout, um, the mental aspect of things. You spoke a little bit about both sides. You spoke about when you have it and not to worry, about it, about the fatigue aspect. So I think there's different stages. Different people are at in the diabetes journey. Very interesting that a 27-year-old is worried about diabetes, and then you have someone on the other side of the spectrum who's frustrated that they're stuck at 8 to 9, if I remember correctly, and been trying and it's not improving, as you mentioned. So the fatigue aspect, so the mental aspect becomes very important. And I think I like the way you said that um, data helps you a lot, right? So being aware, doing your medical tests, doing your checkups, being aware of how are you moving on your journey. And I think the main message you gave in the end was consistency. Consistency is the key. So with that, I want to thank you, Doc. Thanks for taking the time out. Really appreciate it. As always, very detailed, very structured, and I'm sure our listeners have enjoyed it. And yeah, to see you again from Ask Sabai. It's thank you, and thanks, Doc, again. Bye.
All right. Thank you so much, Rohit. Thank you all for tuning in. Have a good day.